welcome back. This is part 2 of 4 in our 4-part series of Dance Your Heart Out. Now, just in case you forgot, we did last time we spoke a great presentation about your heart and your lungs, your cardiopulmonary system. And we learned everything that you need to know to keep your body strong, healthy, fit, and keeping your body moving. And you got a little dancing going on there, so you got a little sweat going. Today, we're going to be doing something a little differently. We're not going to be talking about your heart or your lungs. No, no, no. We're going to be talking about all the joints of your body, specifically why they ache so much and what you can do to make them feel better starting today. Now, you know exactly what I'm talking about. You had that arthritis pain where you've woken up in the morning and you said, I have to get out of bed. Oh, it's going to take me an extra 10 minutes because my joints feel so stiff and achy. If you know what I'm talking about, then you have definitely experienced some arthritis firsthand. And today, myself and Caryn Cooper from Dance to Wellness are going to help you out and tell you exactly what you need to get your body moving healthier again. Hi, my name is Dr. Daniel David. I'm a physical therapist and I run The Traveling Physical Therapist. We provide in-home physical therapy throughout Long Island, covered by Medicare. Now, we provide education, services, and equipment at low or no cost throughout the counties. And today, we're going to be focusing on the education component with our special guest, Caryn Cooper from Dance to Wellness. Caryn Cooper, how are you?
Hey, everyone. My name is Caryn Cooper, and I'm the founding director of Dance to Wellness. We provide exercise and nutrition programs specifically geared for older adults and seniors. And as mentioned before, today we're going to be talking about joint pain and stiffness. So, before we get started, let's talk about what is a joint. A joint is an area where two bones, these are my bones, where they meet. And so bones are connected by connective tissue, better known as cartilage, and also some fluid. There's some synovial fluid, that's nice and fluid motions going. So some common causes of joint pain that happen to us is basically joint pain is defined as discomfort and inflammation of a joint. And so joint pain can be caused by an injury. So if you might have sprained an ankle or, pulled a muscle or something like that. It can also be caused by overuse from physical activity. So for example, we're filming this in December of 2020. And just a week and a half ago, we had a snowstorm. And so I know I saw a lot of people in my neighborhood doing a lot of shoveling there. And, as they were trying to, finish the shoveling more quicker, they were getting some big mounds of snow on those shovels. And I was like, that is way too much snow on that shovel. Ah! And then on the opposite side of the spectrum, another common cause of joint pain is lack of use. So when we're not using our body. So, you may have heard the phrase, if you don't use it, you lose it. And so that's coming into play here. So if we're not using our joints and our bodies, we start to lose that function and mobility. So there are one common joint related disease is arthritis. And so I'm actually going to turn it over back to Dr. Daniel to talk about arthritis a little bit.
So, thank you very much, Caryn. That was excellent. And I loved your snow shoveling. It's just, you could put that into your pantomiming. I love it. So osteoarthritis is one of those things that is for everyone. And I say osteoarthritis because there's different types of arthritis, but the most common is osteoarthritis. And when I say it's for everyone, I don't mean that it's a gift for everyone. Unfortunately, no, it's a curse, but everyone is going to get it. And the saying is that if you live long enough, if you live 200, 300 years, every joint in your body is going to be covered with arthritis. That's just how it is. Unfortunately, fix this microphone here. So unfortunately, you're going to have arthritis in every joint in your body if you live long enough. But here's what you could do to minimize the pain associated with arthritis. Because there is a difference between arthritis and arthritic pain. So, for example, in my neck, I have arthritis. Prior to becoming a physical therapist, I was a professional wrestler. And so I have some arthritis in my neck. I have an MRI. I have a X-ray that shows that. And I could tell you that even though I have arthritis, I have good range of motion here. I have no pain in my neck. So you can have arthritis and not have pain. Very important point. So what can you do to have less pain with arthritis? Well, the top 2 things that you can do are going to be first focusing on flexibility. stretching exercises. The reason being, and Caryn Cooper is going to do a great job explaining exactly how to visualize what it looks like when you have arthritis. But when you have arthritis, you have grinding in one specific area of your joint. So if you think about a joint being the size of, let's say, this, and if you only move in this one area, you're going to wear that one area down. That's where you're going to have the most arthritis. The rest of the joint space is free. It's available, but we tend to not use it because we have tight muscles. We're stiff. So it's very important that you focus on flexibility in all of your joints. So you can have the most flexibility and the most area that you can use to reduce that arthritis, or at least the pain related to arthritis. And what else? Well, the next one you're going to want to do is strengthening, or as PTs, we like to sometimes call it stabilizing. Now, if you have arthritis in your knee, do you want to strengthen your knee? Well, you probably want to have it strong, but you don't want to have it, you don't want to focus too much on that, because when you strengthen a muscle, you tend to do a lot of compression. And you can imagine if we're wearing down a joint, and again, I'm going to let Caryn Cooper do a really excellent job of visualizing what it looks like when you have arthritis. But when you're wearing down a joint, you don't want to keep compressing that one area. No, you want to strengthen other areas of your body. So for example, if you have arthritis in your knee, you're going to want to strengthen other muscles, like muscles in your ankles, the muscles in your hips. So for example, I like to think about walking upstairs as a very knee heavy type of motion. A lot of people have a lot of pain when they're walking upstairs. Well, what can you do so that you don't have pain when you're doing that? If you strengthen the muscles of the hip, specifically your bottom, your tush, your glutes, if you strengthen those muscles, you actually take a lot of the work off the knee and let the hips do more work. So it actually reduces the amount of strain that you have on your knee. In any case, if you have arthritis and you don't do anything about it, it is going to get worse. Now, the first thing that most people think about is jumping to get surgery. And people think it's a silver bullet, a quick fix, but I got to tell you, there's a long road to recovery for both a total hip and a total knee, the two most common joint replacements. It's a long recovery. Sometimes it can take up to a year before you start to feel normal again. And during that year, a lot of things can go wrong. Falls, other comorbidities, other things that are happening at the same time. In fact, people who have hip replacements actually have a 1 year mortality rate. The percentage of people who die within 1 year of a hip replacement is actually pretty high. It's almost 25%. It's a ridiculously high number. And a lot of that has to do with people who are getting hip replacements tend to be a little bit older. However, I can also tell you that if you're not moving because you just had surgery and it's painful, or you don't have the flexibility to move, less movement tends to often cause people to have a higher mortality rate. So it's important. The reason I'm telling you this is not to scare you, it's to tell you to please make sure you exhaust all conservative measures before even considering something like going under the knife. Caryn, what do you think?
I agree. And so when you're thinking about what does joint pain look like? So remember, I gave the image of my two fists being my bones. So imagine, this is the area where my bones are meeting, right? So this is the joint. And so when you have a healthy joint, there's the connective tissue, also known as the cartilage, and then there's also some synovial fluid there. So I'm able to move my bones and joints easily with no pain. But with wear and tear, that cartilage and the synovial fluid is not there. So that healthy space in between the bones isn't there anymore. And so here in my example with my two fists, now my knuckles are kind of rubbing against each other, and even in just me doing this little example here, my knuckles are starting to hurt. And so the same is true happening with your bones. Your bones are literally rubbing against each other, which is causing that really painful feeling that you have when you're trying to get out of bed in the morning and, walk up the stairs and things like that, or walking down the stairs. Walking down the stairs. So there are some common remedies for joint pain. So some most common things people do may take some anti-inflammatory drugs, so like aspirin or ibuprofen. They might do some hot cold therapy. So you might do a heating pad first, followed by some ice. Obviously, rest is a given. Surgery in some extreme cases. but exercise. So exercise really helps to keep the joints nice and lubricated and relieves the pressure off of the joints. And so there's a couple of different types of exercises that people can do that's really focusing on utilizing the full range of motion of your body. And so you might commonly find these kinds of movements in the beginning of like a dance class or a fitness class. And so it's really focusing on different isolations of the body and really focusing on one body part. And so we're gonna get ready to do a little body isolation workout. Are you ready to do that?
I'm ready. Let's do it.
Yeah. So we're gonna get ready to do some nice body isolations here. So you can stand with your feet about hip length apart. And we're just gonna, like I said before, focus on different parts of our body. So the first one that we're gonna start is with our head. And so we're just gonna simply look to the right and look to the left and down to your feet and up at the ceiling. Again, look to the right and look to the left and down and up. One more time, look to the right and the left, looking down and up. Good, looking center. Now we're just gonna do some nice shoulder rolls. So we'll just roll the shoulders back. And so remember, these exercises are about utilizing the full range of motion. So to help encourage that, we're now going to put our hands on our shoulders, kind of like chickens, and we're just gonna roll the shoulders back, leading with the elbows. So yes, I do feel like a bird, more specifically a chicken here. And to really get that full range of motion, now we're just gonna continue rolling, but now leading with the fingers. Rolling all the way around as much as you can. Obviously, if you're having joint pain and this is uncomfortable, please don't push yourself. Okay. All right, so now we're going to move down to our hips, so moving the hips from side to side. Yeah, really feeling the beat of the music in your hips. Nice. Now we're going to take it forward and back, bring it forward and back, forward and back, forward and back. Now we'll take it around in a nice circle. Get some nice hula hoop action going here. And we'll reverse, so rolling in the opposite direction that you were before. Good. Now from here, we're going to open up the chest. I'm just going to turn to the side so you can see what I'm doing. So we're just going to bring the chest forward, opening up the ribs, and then come into a nice curve of the spine. And again, open up and curving of the spine. And one more time, open up, isolating those ribs, and coming into a nice curve of the spine. Good. Now you can face me. We'll have our arms out to the side. We're gonna do some side rib isolation, so going from one side to the other. Imagine someone's playing tug of war with you. And they're like, well, I want you. No, I want you. And you're just in the middle, going from side to side. Good. All right. And now we're just going to do some little gentle bounces with the knees. And then to finish off, we're just going to do some simple circles with the ankle. So you can lift one leg up and circle it around. But if you're having, not feeling comfortable with your balance, you can always have a chair to hold on to. Or you can have your toe on the floor and circle your ankle that way. And same with the opposite foot, so circling that foot. But of course, You can have the chair or rest the toes on the floor and circle it that way. And that is our joint warm-up. How do you feel?
Oh, Caryn, I'm feeling loosey-goosey. I feel like I might just take on the world today.
That's what I like to hear.
That's amazing. Oh, Caryn, I listen, I'm feeling loose. I'm feeling ready to move, which is excellent. I want to do more of this, actually. So this was great. Caryn, if people want to find out more about what you do, where can they find out more information about you?
Yeah, you can find me on my website, dancetowellness.org. You can also find me on social media on Facebook at Dance to Wellness and also on Pinterest at Dance to Wellness.
That's incredible. Well, Caryn, thank you so much for everything you did. And if you have any questions about physical therapy, specifically in-home physical therapy covered by Medicare, you can always reach us at www.thetravelingpt.com, or you can give us a call at 646-733-4737. I think I'm ready for this next, whatever we're doing next, because I'm ready. I'm loosened up. I'm feeling good, Caryn. How about you?
I'm feeling good too. Oh, yeah.
So next time that we get together, we're going to be doing a discussion on a specific joint or a group of joints, not just the whole body. What are we going to be talking about again?
I think we're talking about the spine.
Oh boy, I got a lot to say about the spine. So if you guys are here to check out the next one, the third of our 4-part series, Dance Your Heart Out, we're going to be talking about the spine and your spinal health with Caryn Cooper from Dance Wellness, and of course me, Dr. Daniel Davids, PT from the Traveling Physical Therapist. Until next time, I'll see you guys. Bye.
Bye.